Did you know that the heart makes two main sounds, often described as lub and dub? These sounds are created by your heart valves clapping shut to keep your blood flowing in the right direction. The lub sound, or S1, happens when the mitral and tricuspid valves close. It's like a welcoming bass drum kick starting each heartbeat. Then comes the dub. This S2 sound rings out when your aortic and pulmonary valves snap shut, signaling the end of the show. But what about murmurs? These can be the whispers of a potential problem, a whooshing or swishing sound that might indicate turbulent blood flow. Diagnosing these sounds accurately is crucial, as they can reveal conditions like valve disorders or heart failures before they become visible on any scan. So next time you listen, remember, your heart is not just beating, it's speaking to you. Decode wisely.